Corridors, storerooms, car parks, even restrooms. These are some of the places where patients needing medical attention in the UK hospitals are being treated. Here are some of the details revealed in a survey in December 2024 carried out with 5,000 nursing staff about what's being called corridor care and how widespread it is across UK hospitals. According to nurses quoted in the report, patients were made to wait for long times in trolleys without food, drinks, or even privacy. Patients exposed to infectious diseases and safety was compromised as the identities of patients were sometimes mistaken. Nurses who participated in the survey also revealed that some patients weren't getting any rest at night and that patients were often angry, scared, and uninformed. They added that they themselves faced difficulties in maintaining focus, navigating crowded spaces, and managing multiple tasks effectively, saying that working under those types of conditions can lead to errors, burnout, and a decline in the quality of care provided, with nurses sometimes being made responsible for at least 10 patients. These negligences caused numerous nurses to experience trauma, mental health problems, and burnout, leading many of them to leave the NHS. Because nothing was done to improve conditions in spite of their efforts to escalate their concerns. The crisis affecting both patients and nurses can also have fatal consequences, including deaths and miscarriages, due to long wait times without care, delays, and a lack of safety, oxygen, aspirators, and calling bells. People are dying as a result of ambulances being held at hospitals, and calls are eventually being responded to almost 2 days after 999 has been called, one nurse said. Once admitted to a hospital, the situation doesn't improve, as patients end up waiting long hours to be treated. 54,207 patients waited over 12 hours in December 2024, for example. This is one striking bit of data from Whittington Hospital in London, which shared the number of patients treated in corridors. 2017, 2,294. 2018, 3,246. 2019, 3,655, saying it has faced very significant pressure in urgent and emergency care, and that, as a last resort, they provide care in corridors. All these figures point to a bigger problem across the UK as citizens complain about the crisis becoming a norm and reflecting the broken system of the NHS. Will the country address the crisis as the number of patients mount and hospitals resort to life-threatening measures to treat them?